pregnant and dealing with a yeast infection. Before you reach for that over-the-counter cream, here's what you need to know. Because not every treatment is safe during pregnancy and some can actually make things worse. So let's clear up the confusion. Hi, I'm Rachel Moises from the Mighty Mama Movement, a mother of 8. And
I'm Heather Shelley, and I am a family nurse practitioner and a midwife.
Okay, so Heather, why are yeast infections so common in pregnancy?
Part of the issue is we have a little bit of a harder time digesting sugars, and yeast feeds off of sugar.
Oh, okay.
Or processing sugars, I should say. And also, as everything gets bigger, our belly gets bigger, and as everything gets bigger, our breasts get bigger, there are more places for yeast to hide. And so we become a bit more prone to yeast in pregnancy.
And I've heard that hormonal changes can have an impact as well. Is that true?
Definitely. The higher estrogen levels can result in yeast having an easier time growing.
Okay. So what are the symptoms? Like how would someone start thinking, maybe this is a yeast infection?
So yeast infections can come in different forms depending where it is. For women that, let's say, get it under the breast, where it's nice and moist under there, that usually is painful, sore. It will become red, and when it's pretty bad, you will have kind of a flaming, angry red, and the tissue will be breaking down as well. On vaginal yeast, you'll feel itchy, very, very itchy all the time. And once again, as it progresses and becomes worse, it breaks down the tissue so it can become very red, tender, and sore. And we don't want yeast issues, especially in pregnancy, because if you have a vaginal yeast infection when you deliver, your tissues are more likely to tear and less likely to stretch. So healthy tissue is going to stretch more and go back the way it should, where tissue that is weak because of yeast you're going to have worse tearing, and healing is going to be harder.
Okay, so this sounds pretty uncomfortable no matter where you have it, and I can see how a lot of women would take a little while to realize, like if you're having the itchiness under your breast, just think, oh, I don't know, maybe I was sweating a lot, or
Right.
My bra's getting tight, or I can see how women would go a while before realizing oh, this is actually a problem.
Right.
So I assume that you recommend don't ignore the symptoms
Right.
and take action as soon as you start noticing any itchiness or redness.
Definitely.
Where it shouldn't be, which is nowhere.
So a couple of things that can be done are medications that you can use. Most of them are over the counter. And, we have to say, consult with your healthcare provider, make sure that this is safe for you and your pregnancy, of course. But some of the more common ones are like clotrimazole, meconazole. They're usually used for 7 days. They go as like a suppository, or they have an applicator that the cream is in, and you can insert it in the vaginal area. Under the breasts, you could use like a tinactin spray. They say, it will say on it for jock itch, kind of thing. And it does burn for about 10 seconds, but that works really well. Just, lifting up your breast, spraying like crazy, kind of gritting your teeth for about 10 seconds. And that's usually done once, at most twice a day. And that should clear it up very, very quickly. But of course, for the vaginal, we do need to have something that goes up inside.
Okay, because this is going to be an internal yeast infection.
Exactly. And a really big thing to note is if you have a yeast infection, you must treat your partner. So one of the handouts that I give to women is on not only things you can do to treat the yeast infection, but what you can do to prevent it or for recontamination. So you need to use condoms so that you don't pass it back and forth while it's still active. And men can be carriers, but not be symptomatic. And so once again, if you have this, you must treat your partner. You should not reuse towels. A towel should be used one time when you have active yeast. Instead of using fabric softener, put vinegar in that rinse cycle to help kill any fungal yeast that is happening. Make sure you change your undergarments morning and night.
Oh, okay.
And once again, you need to make sure that your partner is very clean, just because, once again, he may not be symptomatic, but every time you have relations, he can recontaminate you.
So does he have to put any creams or anything, or just using a condom is enough to keep that from sharing?
A lot of times I have the partner do very much close to what I'm having my patient do, as well as a precautionary, because it's just going to pass back and forth.
So how many days, if you identify yeast infection and start treating it, how many days usually do you have to be on this high alert doing all of those things?
So the treatment itself usually lasts about 7 days. If it's not gone by 7 days, you need to go back to your provider, because you may need something stronger or to change the dosage or the type of treatment that you're doing. As far as precautionary, I would say a minimum of 2 weeks, because you could still have trace amounts and you don't want to flare it right back up.
Okay, so it's worth it to just do all of those things for the 2 weeks.
Right. So if you have it on your breast, you've got to wash your bra every single time. Usually we go a while before but you cannot wear a bra twice without washing it in between.
Okay.
And once again, use that vinegar in your fabric softener little spot on your washing machine.
Little container for that.
Yeah, use vinegar on that rinse cycle to help kill it. Yeah.
Okay. Are there any, does it have, oh, sorry.
Oh, no, I was going to say diet.
That's what I was going to ask you. Is there anything else you can do to either reduce your risk or get over it faster or prevent it from coming back?
Definitely cut sugars out. And I don't mean just table sugar, but anything that your body converts to a sugar, cut it out as much as you can.
Yeast, right?
It feeds it.
Okay,
exactly.
Can you list us a few things that we might not realize are sugars?
Yes, bread, pasta, the obvious ones, fruit, juices, milk is a huge one. Not cottage cheese, not so much. So not dairy products, but milk itself.
Okay.
Is a really big one.
And are you saying we need to cut all of those things, all sugars, while we have the active yeast infection? Or are you saying, you know what, if you've gotten once or twice, then just cut it until your pregnancy is over?
If it is, I would cut it for a minimum of 2 weeks. And if you're just finding that this is a reoccurring thing, then I would cut it for quite a while, probably the rest of your pregnancy or longer, because that means it has gone deeper in your system, and rather than just being kind of topical or in an area, it's systemic. And you may have to take an oral medication that will help kill it systemically. Okay. And if you're pregnant, you may not be able to take that medication until you've had baby. And so you've got to do what you can to keep it absolute bare minimum until you have your baby and can take stronger medication.
Okay, anything else? We've covered quite a few things.
Right. So let's talk about some of the more natural things as well that can happen. Coconut oil is a really good one. If you can catch the yeast infection early, you can apply coconut oil multiple times a day, like once again under your breasts or maybe in your armpits if that's where you're experiencing it. You can do it vaginally. You kind of have to get a suppository, like a coconut suppository, and do it that way. If it is a severe infection, you can still try the coconut, but it may not be powerful enough.
It could be like a supportive element.
Exactly. Probiotics are huge. Taking probiotics orally help fight, the good bacteria fights the bad bacteria kind of thing. And yeast usually comes because we have an imbalance in our gut. And so doing a really good probiotic, if you can get a live probiotic, one that is kept in the fridge, those ones are usually a little bit more powerful. Make sure they're in the billions of colonization. And you may have to try a couple of different brands. There are some that are, they say, are more woman-centered focused. I don't know. I always tell people use one for a couple of weeks or for one bottle and then change to another one if you don't see good improvement to see, because brands can have different, you know, that way. And then you can even do it as a suppository as
A
well.
probiotic?
Yeah, the probiotic as a suppository. And that may be, that way it gets right to the source right there. You can even make like a paste and put it on the tissues that are having a hard time.
Can you buy a probiotic suppository, or are you saying like put a capsule
Just put
up
a
there?
capsule up there at night when you go to bed. Yeah, exactly. So, and you can buy liquid ones that you can drink. There are a lot of different options that you can use that way. And then avoiding damp clothing. So when you're exercising, get right out of those clothes. Don't keep them. If you live in a very humid climate, you're going to be changing your clothes a lot. You're really going to be trying to keep your skin as dry and damp free as possible. And cotton is a big one. So wearing spandex, stretchy pants, all of that is not going to help. So cotton underwear is very important. If you can air out throughout the day while you're at home, that is really good. And even like dresses and skirts to help that airflow rather than polyester that is, you're just not going to get any airflow. Those things can really help reduce the environment where it will continue to grow.
Can a yeast infection pass to your baby? I mean, it's infection. You're talking about it being up inside the vagina. Do we have to be worried about that?
In pregnancy, not so much, but when baby is being born, that can pass to baby. And a really big one that happens to women is if they are group B strep positive, they have antibiotics in labor so that their baby doesn't get group B strep. I have found it's almost a guarantee from those antibiotics, because they kill all the bad bacteria, but they kill the good bacteria in the body as well, that those moms and baby couplets, someone's going to end up with thrush or yeast. And so many women will get vaginal yeast from the antibiotics that they had in labor, and baby can get thrush, which means mom will get yeast in her breast, not on the outside of it as much, but in the breast. And some of the signs of that are, of course, the vaginal is going to be itching and rawness and redness. In the breast, it feels like someone is taking a needle and poking it through your nipples straight to the back. It's like these little sharp shoots of pain. And I'll say, does it feel like someone's stabbing you with a needle through your nipple? And they're like, yes, all the way back to my chest wall. So that's one. Their nipples will be a different color of like pink or red. Like it'll, when you've seen it enough, you'll know it.
Yeah,
but it just
you
looks
can tell.
different. You can tell. And for baby, baby will get thrush in their mouth. And so right here and like on the inside of the lip and on the inside of the cheek, they will have white. Okay. Now, the tongue is harder to tell because milk residue and formula residue will stay on the tongue. Yeah. But if it's, so I always say that's pretty normal. I'm not worried about that. But if they've got it right here and right inside their cheek and their lip, you've got a yeast problem. And if baby has it, mom's going to get it. If mom got it, she's going to give it to baby. And so that needs to be treated. There's multiple different things. So at this point, mom can take diflucan internally, but that's not going to help baby. That's going to help mom. And if we don't solve baby's problem, baby's just going to pass it right back to mom every time they breastfeed. So some providers will recommend Gengen Violet. Some will recommend nystatin. for baby, but nystatin does not work for mom. The gentian violet works for both, and the nystatin works for baby, but it's become resistant for the mom. So if your doctor recommends nystatin, do a little bit more research, because it's not going to help women, they found, but it will help baby. And babies can get it so badly that it turns into a diaper rash, that they become, it just passes through their whole system, and their poor little bums will just be raw as all get out.
Okay, so if you've had antibiotics for any reason in your pregnancy,
Yep.
and particularly would be strep B, obviously would be
Right.
an antibiotic right during labor, then you're going to want to be proactive.
Yes.
Starting from
Get
day
on
one
those
of
probiotics.
baby being born.
Right. And that doesn't mean you need to go to the heavy duty diflucan, things right off the bat. But I would absolutely, if you are group B strep positive, let's back up just a little bit. We have all of our moms take a probiotic their entire pregnancy. If there's one in their prenatal, I still have them take an extra. I have found that the one in the prenatal is not strong enough. I have them take a separate probiotic to help kill the group B strep, so that they don't ever test positive for it. And if a mom wasn't taking it and she needs antibiotics now, I'm like, you need to be taking a probiotic from here until 6 weeks postpartum. Anytime your provider prescribes antibiotics, you must be taking a probiotic with that antibiotic, and then for a minimum of 1 month after.
Okay.
Very,
and that's,
very important.
So that's like your number one step to try to avoid
Right.
this becoming a problem after a baby's born.
Right. It's what I actually did my master's thesis on.
Oh, really?
Was the prevention of like using antibiotics and probiotics and what they can prevent.
Oh, okay.
It was actually with C. diff, but
So
we don't want to go there.
Can you give babies probiotics, or just it will go through the
Yes.
breast milk?
Yeah, there are some good probiotics that you can give babies. Some are powder that you would mix with breast milk. Some are liquid drops. At our office, we use, I think it's BioGaia. I'm not sure how you pronounce it. I just guessed. But they have some really good products that you can get for breastfeeding mothers and for babies, and creams that you can use on the baby's bottom that have probiotic. And that's what we give moms to use.
Okay, wonderful. Okay, so bottom line, do not ignore early symptoms of a yeast infection, which is basically itchiness, redness, soreness, and don't think, oh, it's probably just, well, I don't know what you would pass it off as, some sort of skin problem, or who knows. Want to take that seriously, and then be proactive if you have any additional risk factors, like that you took an antibiotic, or you had group B strep, or anything like that. Because it sounds like it's really a lot better to avoid this getting serious.
Exactly. And you don't want it to lead to other things like bacterial vaginosis, which they say it's not a sexually transmitted disease, but they used to say, oh, just treat the women. And I'm like, that does not seem right to me. Why would you just treat the woman and not her partner? And now they have just come out with, if a woman has bacterial vaginosis, treat the partner. To which I'm
As
like,
well.
of course, like you would treat both. Yeah. So, and that when all of these things, they just happen. But it's easy to prevent them. It's easy to correct them if you can catch it early. Don't let it spiral out of control.
Okay.
Get it taken care of, because our immune system is totally different. Everything about us is totally different. I like to say there are 3 species. There are women, men, and pregnant women, because our bodies change so much when we're pregnant. And so everything just changes. We need to be preventative and
Everything's
proactive.
different. Okay.
Yeah.
All right. Well, we hope that helps you if you are watching this video and thinking you might have a yeast infection, or you're just trying to be educated so that you can take really quick action if you have any symptoms come up. And don't forget to check out our free online birth course, How to Give Birth with Practically No Pain. There's a link below that. And that can help any pregnant woman who is going to have to get a baby out of her body and wants to do it with as little pain as possible.